and welcome everyone to the ESRD National Coordinating Center Learning in Action call today. We are focused on vaccination. We have three speakers, Colin, Valerie, and Tiffany with us today. As of September 12th, we shortened these calls to 30 minutes. So the NCC will introduce this and we will get right into the good stuff. So just for some basic logistics here, the call is being recorded. We do send these out, the link to the recording, which is hosted on the NCC's YouTube site. We'll also send out the deck to the network, so the networks to share within their network service area. Everyone is muted. These calls can sometimes get a little bit big, so we like to use chat. We'll try that out here in a minute. And then again, we will share the information from today's presentation with the ESRD networks to share in their service areas. So just to recap, if you haven't joined the LANs before, Learning in Action Networks, we like to use chat to answer questions or provide comments to our presenters today and to one another. And then really we want to move these from learning into action. And so think about what you heard today that you can apply at your facility. You can talk to a colleague about, leadership about, and then commit to share this with your colleagues. So we're going to test this out to make sure that chat is working for everyone. So please answer this question in the chat. Have you previously applied best practices from the change packages to improve outcomes in your facility or at your network level? So just make sure it's selected to everyone and just pop your answer in there if you've used the change packages. Great, thank you, Colin. And then also, if you can see there, that QR code will take you to the landing page for all of the change packages the ESRD NCC produces, with new ones coming out this year and new tools coming from that. So excellent, lots of yeses, a couple of those nos. I will put the QR code up at the end of it. But without further ado, we're going to start with Network 7, and that is Colin Blackwood. So we're going to get started. Colin, you ready?
Yes, I am. Thank you very much. Good morning. Okay. I am ready. So do you want me to, let me get my deck up?
Sure. No, I have them on the deck. If you can see the screen, if you just tell me next slide, please, and I'll drive for you.
All right. Good morning, everyone. My name is Colin Blackwood. I'm an FA in Tampa, Florida. I cover several facilities. I've been with DaVita for, in my 8, going towards 9 years with DaVita. I'm a nurse. And yeah, let's go. Next slide, please. Okay, so our approach to educating patients regarding the importance of being fully vaccinated. These are some of the steps that we take. First, we do a team approach goal, which increase patients' vaccination rate up to 90%. Of all patients by reviewing the medical records prior to patient's admission. So that's when we get them from PPS. That's our application that we use, or from the hospital. We review the records. We educate all patients on admission. We can sometimes do that in the lobby or in a meeting area if they come 15 or 30 minutes, which we require them to come at least 30 minutes before treatment time. And we'll have a small conference with them and their family members and stuff. So at that time, we may educate them, or we may educate them on the treatment floor as well, depending on their mental status, because sometimes this is too much for them and you don't want to overload them with information and stuff. So, you take a cautious approach to that. Also documenting any vaccinations given elsewhere. So some of them may be vaccinated at their primary care or even in the hospital or wherever, the pharmacy or whatever. We'll also document that so the patients, we know their status, so the network can follow it as well. Or, in case we don't give them another vaccination that they already received. And also documenting any vaccination we give in center as well, as a matter, just for tracking purposes. And then we do monthly follow-ups to address any missed vaccination dosage. We address vaccination rate in our meetings, especially IDT, which we keep weekly. In my centers, we have them, well, depending on what centers, but we have them weekly and we discuss that. And then we choose a focused patient and educate it during our plan of care meetings and conferences. Meaning, if a patient is refused in vaccination or does not have enough information and want more information, then, we'll choose that patient as a focus and work with that patient with the social worker or the IDT team to give them the education that they need. Next slide. This is just, typical education that at this time of the year, we always post them on the notification boards, one in the lobby and on the treatment floor. We have several close to where the clean sink is, where they can wash their hands and everything coming in as well. And some of them are posted in center in the treatment floor strategically. So we post this up every year because at this time of the year, it's flu season and stuff. So, it's just precaution. Next slide. So this is this is the facility that I'm reporting on today is Davida Kennedy. It was a 20 chair, but we converted it to 16 because we have a new PD department. We have one isolation room also for AB positive patients. And as of Monday, we were 76. Today, I admitted 2 patients, two new starts. So we're at 78 census, including PD. And our September 23 2023 September vaccination rate so far for COVID is 98%. And then influenza season starts next week, October 1st. So on the 2nd, we should start vaccinating 65 and older or whoever needs it. So those should be shipped to us anytime this week. And we'll start the vaccination process next week. Next slide, please. So we also, before giving vaccination or, there's certain precautions you have to take as well. So we're going to identify patient barriers. So vaccination allergies, I've known someone that got sick from vaccine, religious beliefs, because some people, you have to find out their culture and religious belief before you can administer same. And then patients state they already have it, but aren't able to provide documentation. In this case, I may ask my AA or my social worker to find out where they said they got it. Say, for instance, if they got it at their SNF, because some of them may get it at their, at their nursing homes or private primary care doctors or stuff. We try to trace it and see if we can get the documentation. And then we enter it in CWO. That's a platform that we use, or Anaplan, wherever in our application that we need to do it. And if the patient signed the consents and then refuse on that day, then we may choose them as a focus patients again in our IDT and have a conversation or, further education with the patients and stuff. We can't force them, but we'd like to know why they refuse, and then we'll take whatever approach from there. Then you also have the one that miss treatments as well. Some patients are habitual patients who miss treatments and stuff. We want to make sure we track that as well and give them whenever they come in center. And then patients who are not believing in vaccinations, further education is given as well. And if not enough research is done on the vaccine as well, we'll try to see if we can find a printout or anything, whatever their learning style, whatever it is, education that they require. We'll try our very much best to find that for them. Next slide. Okay, and then this is team approach for a successful educational process. So all staff are educated on the benefits of the patients and the staff being fully vaccinated as well. So during homeroom, weekly homeroom or daily homeroom or huddles, will provide that information to the staff, nurses, techs, everybody, and they're required to sign. The nurses are required to provide continuous education, identify any interested patient, get consent signed, enter the orders, and ensure the vaccinations are given or documented properly, just again for tracking process as well. And the charge nurse will review the medical records prior to admissions, including vaccine records. So we have FAST4 coming from the hospital or admissions platform. The charge nurse is required to review all of these documentations just to check to see if the patient is suitable for inpatient dialysis, or if there's any red flags that we may not caught or need to catch, so we can, work on that. And then the charge nurse is also required to review the vaccination tracker monthly and reschedule any missed vaccination or lab draws. The interdisciplinary team, which is our IDT, reviews vaccination during our meeting as well every week. Nursing staff are all educated in vaccination policies and procedures and re-educated as needed. So every year before we start the flu vaccinations or any vaccination, hepatitis or pneumonia or whatever, we have new policies and procedures and new training that is produced. So everyone has to be compliant before they can give the vaccination out to the patients or teammates. Next slide, please. And then the team approach for a successful education process continue. So we do daily medication counter assure availability, verify allergies, which should be posted in the medical records in our platform CWOW. And if you're unsure and it's not there, it's also on the patient's personal binder. When entering the center or being admitted, the AA is required to go through all of that as well. And any allergies that the patient has, it has to be posted on the binder for everyone to see that we have binder allergy stickers. So it's there for everyone. So if you're not sure, you just check the patient's binder, which is kept in the file room. Doctors reinforce vaccination education when rounding. On the monthly rounding with the doctors or the nurse practitioner, we will reiterate to them, help us with the education to the patient and stuff, and let them know the importance of getting vaccinated. So we always ask the doctors to intervene as well to provide intervention. And also, like we said, talk with the patients and hear their concerns and revisit it monthly and re-educate the patients and vaccines as needed. And then again, we address all patients who refuse in our monthly meeting, which is our FHM with the medical director. That will typically help us to increase vaccination rate to at least 95 or higher at my center. Next slide. That's it. Thank you, guys. Are there any questions? Okay, celebration process or meeting your goals, or how do you acknowledge your successes? So we acknowledge our successes by, again, during morning huddles or weekly homeroom meeting. I would go with whatever information we have, whatever development, anything, and I'll speak to my team about that. So, before I'm starting those meetings, I always greet my team with the great news first before we go down to what you didn't do or what we can do better. So, always give them kudos and stuff. And depending on whatever it is, I'll get them a gift or buy lunch.
Sounds great, Colin. Thank you. And if you do have other questions or comments for Colin, you can pop those in chat. Excellent process. We're going to move on to Valerie Henry. Valerie? Are you there? Just waiting for Valerie to unmute herself. We will move on. She is representing Network 8 today.
Can you hear me? Oh.
You'll just have to mute your phone if you have it up on two places. There we go. Better, Valerie? Oh, we had you earlier. Sorry we lost you. Let me give Valerie just one more minute here.
Can you hear me?
I do. I hear that echo. I didn't hear your echo the first time we did audio check, but I do hear it now. So if you have us up on two browsers or there's someone else nearby, that might be the cause of that echo. Oh, and I think we lost Valerie. We're going to move forward then with Tiffany. Reese-Arrington, are you ready?
I'm here.
Okay, then everyone just pause, close your eyes. I'm going to quick scroll to her slides and we'll do Valerie. It's all yours, Tiffany.
Thank you. Good morning, everyone. My name is Tiffany Reese-Arrington, and I'm the new vaccination project lead for Network 9, and I will be presenting on healthy living today. Next slide. So what my agenda today will be going over the Healthy Living Initiative, what it is, who does it entail, and then, of course, the new launch of the Healthy Living Bingo, the purpose of it, what it entails, how to apply within your facility, possible barriers, and then its launch when it can be found. Next slide. Currently, the goal of CMS is to focus on increasing vaccinations within the ESRD population, but while CMS strives to develop guidelines around weight reduction, obesity, and the BMI metrics, the network is wanting to increase the awareness around the Healthy Living Initiative. The focus is on the overall health of an ESRD patient while incorporating preventive measures to manage comorbidities. We want to continue to encourage patients to develop relationships with a primary care physician so that there is trust within the healthcare facility, healthcare system, and increased positive trends in necessary testing and vaccinations. This is the perfect opportunity for facilities to elect a wellness champion, someone that enjoys educating individuals and participates with healthy living habits. Maybe they exercise. You want this individual to foster a change in the mindset of both other healthcare workers and patients. While the objective of the clinics is to provide dialysis, the ultimate agenda is to provide life-sustaining treatment. So if you're unable to elect a single individual, this is a great time for the entire staff to work together to collaborate. Include members of your IDT team to collaborate. While working with your FA, your dietitians, your social workers, nurses, and technicians, we can promote health wellness in our patients' everyday lives through weight management, exercise, treatment advocacy, and all preventive care. Next slide. So healthy living bingo. Why bingo? What better way to attract the audience than with socialization and fun? It's an added benefit as a methodology to release stress. Keeps your mind, it actually keeps the the treatment time off the mind of the patients while they're sitting in their daily treatment chairs. Finances, family issues. So definitely just keeping your mind active while you're sitting in the treatment facility. What is it? It's a fun, interactive approach to bring awareness of all aspects of healthy living to our population. A tool that will not only engage the audience, but will promote health literacy. The definitions are inclusive of terms related to types of accesses and how to care for them, ways and methods to manage weight, whether it's to reduce or gain. Individuals that are part of the care team, and of course, even preventive measures to help manage end-stage renal disease. How will it work? Bingo can be played both virtually and live, so the ability to participate is available anytime. iPro will provide materials for the game, including the 10 bingo cards, the key sheet, which will include images of the definition and the term, and a PowerPoint slide deck to play online. This is the perfect time for your wellness champion or your healthy living champion to make a debut. And again, if unable to nominate a single or individual, collaborate with your IDT team to help facilitate. And games can be played in center and within home departments. So please do not make this as it's just an in-center priority. The home department is able to participate. They can do it online, or if they have support groups or they offer like in-live training, group trainings, this would be the perfect time to apply that. Next slide. So these are your resource highlights. This is a screenshot of the Healthy Living Bingo key sheet. That's a part of the packet. Page 1 provides an introduction to the objective of the game and then proceeds to explain on how to prepare to play. Just a touch on a few highlights. Number 1, on the bottom right-hand side, you will see the pages of what the bingo cards look like and what the images look like. This is what your participants will utilize during the game. So please be mindful that there are 10 specific cards and they are all numbered. So if you plan to play with more than 10 people, be prepared to have more than one winner. Second thing, although we are providing the bingo packet, participants will need some sort of marker, bingo chips, change of some sort of writing material like a pen or pencil or marker. Please be advised it's not necessary to go out and buy branded materials, branded chips, or those ink dots. You can utilize what you have in a building, including pieces of paper, and just shred it up. Schedule your game accordingly. You want to build up the hype, so post flyers, get your team to talk about it, put it on the treatment floors, involve your PFRs if you have one in your facility. And whether or not you believe it, word of mouth definitely does encourage and promote things. Number 4, before you begin, make sure everything is in alignment. You want to make sure that your PowerPoint opens and the navigation buttons are functionable. Your virtual platform is set up through Zoom, WebEx, Skype, Google Hangout, FaceTime, whatever. You just want to make sure that everything is working in good condition. And lastly, this is a key time to determine the rules of the game. Everybody knows bingo, but you want to make sure that you put it out there. While many are aware of how to play, you can assume so to make sure you clarify if allowing all wins are allowable. So you want to do horizontal, virtual, diagonal, 4 corners, or complete blackout, which basically is all of it. On page 2, there are the instructions provided of screenshots of the PowerPoint slide deck, what to look for. The 3rd page gives a description to the navigation buttons. Next slide. So this is what you're going to receive when you get the PowerPoint presentation. So let's play. I'm going to give you a live demonstration on how to play virtually. So as you can see, there are a total of 32 definitions. You can opt to randomly pick and click on a number, or you can basically just pick one as you go. I will choose option number 12, or basically bingo chip number 12. The person facilitating will then read the definition, and the players will choose an image on their card with the term. When ready, click button to reveal. So if you could click the next page for me. As you can see, the first thing that comes up is a definition. Your choices about what to eat and drink while on dialysis can make a difference in how you feel and can make treatments work better. While you're playing this game, you want to give the patients, anyone that's playing, the ability to, figure it out. They have the key sheet. It has the terms available. Give them about 5 or 6 seconds. And then you want to click to reveal. Next slide. And what will populate is the picture of the definition. Again, this is the ability to have them give health literacy, understanding of what's happening to their bodies while they're in dialysis and outside of dialysis. Next slide. So you want to know when it's launched. It's going to be October 1st. It will be available on iPro Learn, coming to a facility near you. When clinics log in, it will be found under the ESRD Facility Quality Improvement 2021, as you can see for the title. The game will be available to all facilities, available effective October 1st. Next slide. So if you come across any possible barriers, and I know there's going to be some questions. I've worked in facility. I was a facility administrator as well. You're going to come into some barriers or some kickback. The first thing that's going to come up, they're going to say, I don't have time, there's too much going on. You have downtime. There's ability to have those moments when your turnover is over. You can absolutely apply this game. You schedule and advertise and promote. If you put it on the schedule, you make the announcement, you make it available to all the teammates and the patients. They are aware and they'll be looking for it. I promise you, it happened at my facility. They'll be looking to play for that day. And of course, you just want to put it out there in the atmosphere that if you can't do it in the facility, it's going to be available online, but if you schedule accordingly, you should be able to play with no problems. If you have language barriers, you should be able to reach out to your interpreter devices. If you have phones, if you have laptops or computers, you can definitely type these things in ahead of time so that they're definitely prepared. Use your bilingual staff that's available to you for that day. And if they're not available again, if you schedule accordingly, they should be in the building. Engagement, if you can, incentivize. But sometimes I feel like bragging rights are a big thing. That was a big thing in my facility. So the fact that they won was enough. If you have staffing issues, utilize everyone, your RNs, your technicians, your IDT, and your PFRs. You'd be surprised when you finally start the game how involved everybody gets. And then, of course, the ultimate, it's the space is off. We don't, the way the setup is just a little awkward. Utilize what you have in your building. You have phones, you have intercoms, you have television. You have everything available to you at your hand. And so if you take initiative and apply and schedule accordingly, I promise you'll have a day of fun. Next slide. Any questions?
Thank you, Tiffany. And
Thank you.
Once you give us the information, as I put in chat, the NCC will be sure to send out the activity details.
Thank you.
Excellent. Thank you for speaking quickly. I know we're on this abbreviated timeline, trying to get right to the good stuff. And Valerie, are you back with us?
Can you hear me?
Yes, I can. Don't touch a thing and I'll do your slides, okay?
I'm trying to get the camera to work and
no, don't touch anything. You're great. We're ready for you.
Oh, it's crazy. We've had a crazy day here too at work. It's just been a crazy day. Anyway, I'm sorry the camera doesn't work. Okay.
You're totally good, Valerie. Take a breath and just walk us through what the good work you're doing.
Okay. What I was trying to focus on was vaccine management and conquering vaccine hesitancy. And I work at Dialysis Care Center Cleveland, and I've been in dialysis for 30 years. And I tell everybody I started when I was 5 years old, but not really. I feel like steps to success are set high goals for your facility, implement strategies for continuous quality improvement, adopt interventions to reach those goals, and educate and respect. Educate the patient and respect their decision. Next slide. Introduction to improvement is a process. You must identify the problem, define the goal or result that you're reaching for, incorporate your entire team and get everyone involved to help meet the same common goal, provide the staff, such as the PCTs, also with the data and information, so they can also act as educators and help to reinforce the vaccine education given by the nurses. A lot of times they can talk to the patients and the patients will listen to them, or the social worker, dietitian, home therapy nurse, whoever, when they won't listen to just the other nurse on the floor. Sometimes they listen to the doctor, not the nurse. Sometimes different staff members have a different rapport with the patient. I feel like all the staff should be educating the patients. Identify the areas that need improvement and set time limits to try to reach the goal. You have to have a time. I feel like you have to have a time limit to have set that goal to reach for something. Next slide. Implement strategies for continuous quality improvement. Collect all the vaccine data and report this in your monthly quality improvement meetings. Produce reports sorted by vaccine from your electronic medical records. We every month I made my own tracker from Excel, and I list all the patients and which vaccines they have, the dates they have those. I put in there like when their next pneumonia vaccine is due. I put in there, when they have the flu vaccine, which COVID vaccines they have, whether it's Moderna, Pfizer, whatever, whether they have a booster. I put all that in there so I can just glance at that and see what they've had and when something else is due. And I look at it each month and I report those numbers in my quality improvement every month. And we can just print a report every month by vaccines given, and I can update that list. Create methods that work for you, which vaccines are due for each patient and when, and have a vaccine manager if possible, which that's what I was talking about doing. Report vaccinations of patients and staff in the CMS identified system for reporting vaccinations, such as the NHSN and EQRS. And I think all of us know what those are. Next slide. Adopt interventions to reach your goals. Inform patients they can get vaccines at the facility, and it's not necessary for them to have to go to the physician's office or the pharmacy. A lot of patients come to the dialysis clinic and don't really go anywhere else. This is pretty much the only place some of them go, and they don't really have transportation to go elsewhere. So let them know that they can do it here, and it's a lot easier for the patient, a lot more convenient. Prepare the patients ahead of time. Let them know that they will be getting, like, their flu vaccines will be giving next week, or let them know that so they can prepare. Have sufficient inventory on hand. Schedule vaccinations for home. therapy patients when they come in for their clinic days each month. Use a patient-centered approach. Next slide. Educate and support and eradicate barriers. Educate, answer questions, and respect the patient. Collect brochures and information about each of the available vaccines and give this to all of the patients, and educate the patients about the available vaccines. Explain why all of them are not only important but necessary. Their immune system is not as strong and they really need the vaccines. Answer all their questions, address the concerns, and answer all the questions they have to his or her satisfaction. Re-educate annually and as needed regarding vaccinations. And if they refuse this year, ask them again next year. If they refuse next year, ask them again the next year. Distribute educational materials to support the information that is given to the patients to help support the facts. Dispel myths. Provide patient with credible resources. Once a patient's decision is made, we respect that decision. After all, it is his or her decision, and we do not want to make the patient become less receptive to vaccinations and completely be closed to the idea. Because if they refuse it and we respect that decision, they might agree to another vaccine, or they may agree next time and not just shut you down when you ask again the next time. You have to listen to what they have to say and their concerns, and do it without judgment. And do follow up each year and follow up with each vaccine. Next slide. We do everything every day for everyone that we can do to make their life better. I feel like in dialysis, every day we make a patient's life better every day, because we make a difference every day in their life. That is what being in the medical field requires of us. We need to make a difference in the lives of our patients every time, because if we don't, then someone else may not. What if they're not here tomorrow? I want to say that I made a difference today. So I feel like we need to do everything possible to make their life better, because I feel like that's what we need to do in the medical field. I feel like that's what we're here for. And I feel like that's necessary. I feel like doing the vaccines is part of that. I feel like that's just as important as giving their medications, or just regular medications, or doing their dialysis. I feel like it's all a part of the prescription plan or the care plan. I feel like one thing is as important as the other. Next slide. Do something great. Okay, any questions?
Excellent. Thank you, Valerie. Love the inspirational talk at the end. I think, right, we can't say enough thank you and gratitude to healthcare workers and everybody out there, supporting folks with kidney failure. So we are at time. If you do have questions, you can feel free to email us at nccinfo@hsag.com. I'm going to click to the end here. I just want to put a quick plug to if you haven't seen the change packages, there's a QR code. You can quick scan that with your phone and pull it up. And also, please, there is a very short survey when you close the browser when I end the meeting, just asking about the time. If you can, please take that post-event survey, even if you just answer the first question for us to talk about the time length. We would appreciate that. This one was at 12 noon. They'll return to their normally scheduled 2 p.m. time slot with our next presentation on nursing homes in the dialysis care. So thank you, everyone. Be sure to look us up on social media and follow us, and we will send the deck and activity highlights to the networks to distribute. Thanks so much for joining today. Take good care.